a volunteer with the Dayton Area Chamber of Commerce. You are watching Business Connection, a production of the Dayton Area Chamber of Commerce. The Chamber is committed to finding business solutions by collaborating with regional business leaders on key issues. Our guest today is Jeff Mullins of Taft Law. And he's been here before. We have talked about this topic before, but it definitely warranted some more conversation. It's the Affordable Care Act. How are you, Jeff?
I'm great, thank you.
It is so good to have you back here. Now, the Affordable Care Act, passed in 2010, is undoubtedly one of the most important landmark pieces of legislation in the history of the United States. It is rivaling the Social Security amendments of 1965 that led to Medicare and Medicaid. Now, almost 3 years after its creation, there's still many questions out there about the ACA and what it means for everyone, business owners, patients, and other citizens. Today, we will focus on how the Act will affect businesses. Now, because of the complicated nature, Jeff, of the ACA, some employers are opting right now to still do nothing about it. Now, what are the risks with that kind of strategy?
I think that's a very risky strategy. I like to tell employers that when it comes to the Affordable Care Act, there's winners and there's losers. And they're not always the ones that you would think, but there are winners and losers. And I don't recommend that companies go out and adopt far-reaching strategies immediately, but I would recommend that companies have a short-term plan for how to deal with the Affordable Care Act, and at the same time that they be developing a long-term strategy, because as you just said, this is a landmark piece of legislation. It changes almost every aspect of the delivery of health care in the United States, and it's going to change in a considerable way the manner in which employers provide benefits to their employees. So I think you have to be working with individuals that understand the Affordable Care Act, your broker, your accountants, people like that, to have a short-term plan. And a lot of employers have different options right now, many of which can save them a considerable amount of money, because for some employers, for most employers, your health insurance benefits are a large portion of the expense side of your balance sheet. And if you're not, if you have a 20 or 30% or 40% increase in that part of your balance sheet, unless you have unless you're having a very profitable year, that can really hurt your business. So I think people need to be looking at that and understanding that if they're doing nothing and they're just going to accept what happens and wait and see, they could have a really difficult next 1 or 2 years. The better plan is to say, I'm not going to do anything drastic, but I am going to talk about some of the short-term plans that I can put in place to deal with the cost increases that I'm facing, and also to have a long-term strategy that you're watching what's happening with your competition, watching what's happening in the health insurance market, and there could, in the next 3 or 4 years, 5 years, be some really major shifts in the way that employers provide health insurance and in what it costs for employers to provide it.
Well, getting down to cost, I'm sure you've heard, I think we've all heard, some employers saying, well, it's just going to be too costly for me to provide health benefits now to my employees, so I'm just not going to do anything. But there's still a cost related to not doing anything, correct?
Well, there absolutely is. You know, for employers, some employers, when they say that, they're a small employer, they're under 50, and they're making the decision to stop providing benefits. Cost there is, if the larger employers are, and you're competing for good workers, it's going to be hard to keep your workers if you are simply saying to them, look, you need to go to the exchanges and buy health insurance, we're not going to provide it. But another employer, a larger employer, is providing those benefits, and there are tax benefits. One of the biggest things about health insurance benefits is that when the employee receives those benefits, they're not counted as taxable to the employee, and the employer gets a deduction for providing them. So it's sort of a double benefit. When employers provide health insurance, they can put that into your overall compensation package. If you decide to stop doing that and someone else is doing it, you may lose some good employees. If you're over 50 and you decide to stop doing it, that's when the penalties that we discussed last time kick in. And then you have to pay a penalty for doing that. And the penalties, guess what, are not tax deductible. And so for a lot of employers over 50, I mean, I will say I've probably done a couple hundred of these now, the analysis, worked through it with employers. And what I found is that maybe in only 4 or 5 cases did it make economic sense for the employer not to provide the insurance benefits. In almost all the other cases, they were able to find a way to comply with the act and provide the benefits, and it was still more cost effective than paying the penalty.
And you make such a good point, you know, as a potential employee, that's what I'm looking at companies, you know. A big part of it, you know, is the benefits program. So, yeah, it's something to definitely keep an eye on. Now, we've heard that the IRS is not intending to aggressively go after the collection of penalties early on. Now, what impact do you see this having?
I've come at this as a lawyer, and that's we're always looking at in many instances what's potentially the downside. If the IRS says to us we're not going to aggressively pursue penalties, I'm not sure what that means. Will they non-aggressively pursue penalties? Will they? We should be collecting 100% of the penalties, but we're only going to collect 50. I mean, if they were to say in a regulation or in an amendment to the act that we're not going to do this, we're not going to collect penalties in 2014 or 2015, I feel a lot more comfortable about that. But when they simply make a statement that they're not going to as aggressively enforce them, hard to advise a client that the right course of action in that circumstance is to be in non-compliance.
Right, because you really just don't know.
You're rolling the dice.
Yes. You know, you've talked about, you have been dealing with different businesses now for a while. You know, what are some of the other things that you're hearing from businesses, their concerns?
You know, there are, depending on the size of your business, what kind of employees you have, what you're paying those employees, how the pay breaks down. Do you have a lot of people at a lower rate and a few people at a higher rate, most people at a higher rate, some people at a lower rate? But depending on a variety of factors, there are all sorts of different options for employers. There used to be you're fully insured or you're self-insured. And now there's all sorts of different options that are on the table. And in some cases, you know, there are, if an employer stays with what they're doing right now, that could be a lot more expensive going into 2015 and beyond. And so if they're paying attention, some of those employers are looking at, you know, making some changes that will help them. And you really have to look at what the product is that you're getting. Just to give you an example, we had a company that had always bought health insurance through, you know, an Anthem or United, but there are some other companies springing up, you know, providing insurance benefits, and they're providing what they call, I call at least a quasi-self-insured product, where they say instead of having to have 100 employees to be self-insured or more, you can have 25 employees and be self-insured. But you have to look really closely at those policies, because sometimes those policies, even though they're more cost effective, they don't cover the things that your old plan used to cover. A good example of that is self-injectables. A lot of these smaller self-insured companies, people that have MS, people that have rheumatoid arthritis, people that have diabetes, they need to take injections every day. They don't go into their doctor's office to get the injections. And sometimes those injections over the course of a year, if they're not covered at all, can cost $50,000 or $60,000. And I've seen a few situations where those plans, because that's not required to be covered under the Affordable Care Act, they cover all the stuff the Affordable Care Act requires them to cover. They quit covering stuff that they used to cover that it doesn't. And so you really need to look at the fine print, be careful, look at the various elements of the plan and really understand. Make sure you're buying what you intended to buy, particularly, you know, when you have employees that are in a situation where they need that kind of coverage.
Oh, sure. You say how important it is to read that fine print. I'm sure some Some businesses are just afraid of the whole process.
Oh, very much so, and I think it really is, it brings out some avoidance behaviors. If you're afraid of something like this, if you don't want to deal with it, then you just want to say, well, let's re-up for whatever plan I'm in for next year, and I realize it's going to be an increase, but I don't want to think about all those other factors. Well, you know, if thinking of all those other factors, you're going to be able to get a plan that's a 5 or 10% increase instead of a 30% increase in one of your largest costs. You know, that is something I think employers should do and ought to be doing.
Absolutely. Now, the Act imposes regulations from HHS, DOL, and the IRS, making it a little complicated for businesses to follow. What advice would you give our audience on ensuring compliance?
On the internet, you can see some pictures of the Act and the regulations, and at this point, usually they put it on a chair with a bow on it, a red bow, and last time I checked, it was 7 feet tall. And I bet, and that was several months ago, so I would be willing to bet that it's probably 8 or 9 feet tall now, and still growing. No, it's very difficult for an employer to try to come into compliance and understand and know all of those regulations. What I tell people is let's focus on the big ticket items. Let's focus on the items that if you get this wrong, it could have extreme consequences for the employer. One of those is, am I a large employer or not? And there are accounting rules that you can go through. And obviously, if you're a 1,000-employee employer, it's not an issue. If you're a 10-employee employer, not an issue. But if you're somewhere on the bubble, the count doesn't work exactly how you would think it would or how common sense would tell you it should work. So you need to be careful, because if you think you're a small employer and you're not providing insurance, and actually you're a large employer and you're required to, that could be a very expensive mistake. The other one, if you are a large employer and you know you have to provide insurance, to whom do you have to provide that insurance? Well, you have to provide it to full-time employees that work 30 or more hours in a week. And again, determining who those full-time employees are is not as easy as it might sound. And so you could have a whole classification of employees that you thought weren't eligible for the insurance. You know you have to provide it, but who do you have to provide it to? And if you make a mistake there with a large group of people, again, it can be very expensive. Making sure that if you are a large employer and you provide insurance, that it's affordable. You know, that again is one of the requirements. And if you think the plan you're providing is affordable and you calculate it but you do it incorrectly and it's not, and that affects a large segment of your workforce, those are the sort of, I would say they're the mortal wounds. Those are big, expensive mistakes. And I'd say for starters, let's make sure we've got the basics down. And then we can move on to the other issues that need to be dealt with, but I would start with those.
And you've touched on this, but what are some of the trends that you see in the local market in terms of employers' reaction to the ACA?
Just earlier when you said some employers are doing nothing and sort of waiting to see, I do see a number of employers doing that. I also see a number of employers who are becoming very proactive, who are looking at this and saying, as I mentioned earlier, there's winners and losers, and I want to be one of the winners. And I'm going to get there by really examining this with my accounting folks, with my broker, with counsel. I'm going to make sure that the decisions that I make in the short term are going to help my company be profitable. And the other thing I see people looking at is that there are people that are trying to project out a few years and ask themselves, what could happen? What would I do if my competitors decided to put their employees in the exchange and just start paying the penalties? Should I be looking? There are things called, you know, you have the public exchanges. There's also things called a private exchange. And most of those private exchanges, they're run by big organizations like there's one that Mercer has. There's one that Anthem has. It's called Bloom. But these private exchanges, employers can go into those, and instead of just providing employees with insurance, health insurance benefits, co-pays, things like that, they go to a system where they provide employees with a defined contribution health insurance plan. Just like now, 401k is a defined contribution benefit plan, and you get a certain amount of money. And they'll say this to their employees, you'll get X dollars. And that's what I'm going to provide to you. And if health insurance costs go up 25%, there's this private exchange we have. You can make decisions about which plan you want to buy, how much it's going to cost, how you want to spend those dollars. But we're not going to raise the amount by 25% just because insurance went up by 25%. We might raise it 3 or 4%, but we're not necessarily going to track the market. And you may have to make decisions about what you buy and where you buy it based on those increases. And the theory there is, years ago, I can remember when things shifted from everybody having a defined benefit pension plan to a defined contribution pension plan. The idea is something very similar may happen in healthcare. And I think trends like that, people may not want to do that in their first year and jump right into it if all their other competitors are doing something else. But people are watching that very closely, because you may not want to be the first one that jumps into that, but you may not want to be the third one either. Because if it's going to save a lot of money and if it's the new direction that most of the people in your industry are going to go to, you don't want to be too far behind the curve.
Some people seem to think that small businesses are exempt from the ACA. First of all, is that true? And, is there, when it comes to the legal and the tax compliance issues, is it true? What I find with the small businesses is that there will be people who are sort of excited that, man, I'm under that 50 number. I'm not a large employer. Thank goodness. Boy, that's a great relief. The problem is that it's almost ironic, but the people who are impacted the most by the Affordable Care Act are the small employers. And while they're not directly covered and required to provide insurance, many of them, for the reasons I said earlier, want to continue to provide insurance to their employees. And for the small employers, there's a thing called community rating that's in the Affordable Care Act. And that is changing the way we calculate rates. And instead of looking at a variety of factors and an employer's specific population, they're looking at a whole community, your zip code, and what the people in that area look like in terms of their general health and their health conditions. And for some people, older people may pay a little less on individual policies, younger people will pay a little more, but overall, going to a community rating system, I think the Ohio Department of Insurance has estimated that that's going to be 30 to 40% increases for people in that. So if you're a small employer and you're fully insured and you have to go in and buy insurance with that community rating, it could mean a big jump in your insurance costs. And so that's where I look at that and say, if you're a big self-insured employer, there are things you can do if you're paying attention and you've got the wherewithal to do it. You can keep your health insurance costs fairly even, and maybe over time they might go down. If you're a small employer, you don't have that wherewithal, and you're used to just going out and buying an insurance policy, and now that policy is going to cost more money. So those small employers are also getting creative and looking for ways to deal with this. One of them is the quasi-self-insured packages I mentioned earlier, but they're looking for ways to deal with this too. But if they don't, this, I believe, will have a bigger impact on small employers than it will on large employers. What is your advice for really any type of business who maybe I've been putting it off, maybe I'm afraid? Mm-hmm. What's your best advice to be prepared and have a plan?
I think the best advice is to, a lot of times you'll say, I only want to get input from one source, my broker or my accountant or my attorney. I would tell people in this instance, get input from multiple resources. Talk to a number of different people and try to find out all the different ideas and strategies that are out there. And as I said earlier, I would look at this and say, for the next year, I'm going to make some adjustments. I'm not going to jump into something that's drastically different than what I'm doing right now, but I'm going to come up with a short-term solution that keeps me competitive, both in terms of my wages, my benefits, retaining my employees. But I'm also going to start a process, and I'm going to try to identify some people within my company who are going to be responsible for looking at what's going on out there in the market, what other people are doing, being informed about how the Affordable Care Act is unfolding. And it does. Every day, it seems like there are changes, new issues coming up. And some of them are big in the press, not so big in in how they impact businesses. Others are very quiet in the press, but they have a major impact on businesses. So I would say have someone in your company that's going to be a point person that's going to be dedicated to sort of monitoring this over the next couple of years, and who's going to be tasked with developing sort of a long-term plan that you can put in place incrementally. You know, you don't go from here to here all in one fell swoop. Best way to do that is to try to move toward it in steps. And I would say maybe over 5 years, I really do believe the things are going to look very different than what they do now. And so employers need to start thinking about how they're going to prepare for that. I wouldn't recommend that they try to do anything drastic immediately. Let's watch how this develops. And depending on which path it goes down, you want to be prepared to respond.
And it's always nice when a business is involved with the chamber, the Dayton Area Chamber of Commerce, because they provide programs for different businesses. I know that you recently have helped out with some of that as well, correct?
The chamber does a fantastic job in this area. They developed a task force to look at healthcare issues for employers. They've done multiple presentations, and they've really allowed employers to kind of come in and see if they're willing to go and willing to participate, what all these different strategies are, what all the different options are, and they bring in experts throughout the region. At the last one, I think they had the area president for Anthem that came in and talked about their offerings and how they're responding to the Affordable Care Act. So they're bringing in really top flight speakers, people that are at the heart of the industry and the heart of the issues that employers need to deal with.
Now, do you find that you're doing more and more presentations?
3 this week.
3 this week.
Yeah.
But it's good because people are reaching out, getting those resources and getting the information, because that's so important.
We had a 1-year extension really for employers in this, and it's sort of, I look at like you got an extension on turning in your term paper or whatever. We got a 1-year extension, and so at first I think people sort of sat back and breathed a sigh of relief. All of a sudden again, people are starting to say, I've got time to get this done, to do it right, to prepare for it, and I think they're looking for information and for help.
Do you think there will be any more extensions, or should we just be on it now?
I would say let's be on it now. I think for the business, there are questions about how things are going to roll out next year, but I think the best information we have and the assumption we should be working on is that the part of this that impacts employers will go into effect in 2015. There are other issues with how it impacts individuals, how it may impact senior citizens, but I'd say for the employers, best assumption to work on is that it's going into place in 2015.
Anything else that you would like to add, Jeff?
I think that's it.
Great job as always,
you.
and we appreciate you coming by.
Thanks for having me.
Thank you. And thank you so much for joining us. You've been watching Business Connection. Now stay tuned for a message from the Dayton Area Chamber of Commerce.
Today's show is not only important to employers and their employees, but also very timely. For months, the Chamber has been working with a number of key partners and resources to do our best to inform and educate employers on how to make the best decisions concerning health care for their companies, their employees, and their families. From the beginning, we knew this national program was going to be a challenge, one that you may think was only politics, but actually was more about the enormity and complexity of the process. There are some very good points about the Affordable Care Act, but I've always been deeply concerned about the rush to implement and the complexities of the overall plan. Some of the complexities include the employer and personal costs, lower for some, higher for others. The plan includes younger adults who need a health care plan, but many won't even buy it today when employers pay 60 to 80% of the costs. And now we're struggling through a sign-up phase. The Chamber continues to help counsel businesses through this process. Our event on November 14th was yet another public forum that allowed experts like today's guests to share insight and knowledge about how best to navigate this new world of healthcare insurance. Healthcare coverage, with a strong push by trade unions, evolved over the years into one of the best non-taxable benefits many of us ever had through our employment. The newest evolution will dramatically change this for many, and you will best be served with expert help from professionals like your insurance broker, accountant, and/or attorney. We all can ill afford to compound this process and its complexities with poor information. Thank you for taking time to learn. Hopefully you took notes. I know I did.